proposal included in the state budget means that childless adults could be forced to shift from Wisconsin's Medicaid program, known as Badger Care Plus, to the online health insurance marketplace, where they then have to find coverage on their own. Kristen Barbarisi spoke with a cancer patient about the possible impact.
Pete, the plan would limit those childless adults making less than $12,000 to 4 years on Badger Care Plus. But some with chronic illnesses say without the Medicaid program, they can't afford insurance. John Zimmerman of Wanakee has fought lymphoma for 3 years and also has diabetes. He says his illness only allows him to work part-time, and he's looking at what he could do without Badger Care Plus, but doesn't see a solution.
Just don't know what the options would be right now. What I want to do is just be able to live a normal life as long as I can, you know, and be able to meet my responsibilities without being a burden for everybody else.
Now, Republicans contend Medicaid is not a sustainable option. During the Joint Finance Committee meeting, Representative John Nygren said, quote, "What we choose to do is rather than put more people on a system that reimburses at pennies on the dollar, is we choose to send people to the exchange." Nygren is a co-chair of the Joint Finance Committee, which approved the budget proposal this past week. He says that subsidies would help people pay for those plans in the marketplace. Now, the federal government does have to issue a waiver in order for Wisconsin to implement this plan.
Okay, Kristen, thanks. The budget proposal allows the State Department of Health Services to decide if there would be any exceptions to the 4-year rule. It would also add premium payments for Badger Care Plus patients. That would require a waiver from the federal government to take effect.
At the request of Governor Walker, the Joint Finance Committee approved a plan to limit the total amount of time childless adults can receive Medicaid benefits in Wisconsin. Badger Care Plus is the Wisconsin version of Medicaid, which is for individuals who earn less than $12,000 a year. Under the plan included in the next 2-year budget, Wisconsin will ask the federal government for a waiver to allow the state to charge Medicaid premiums to childless adults and end their eligibility for the program after 4 years. Representatives with the American Cancer Society say that would create a hardship for a number of their patients.
Cancer is not something that often is, diagnosed, treated, and that's the end of it. Unfortunately, there's often a lot of prescriptions, long-term side effects, as well as, a risk for recurrence or a secondary cancer. That means that, 4 years doesn't really fit into the scope of cancer care.
The plan offered up by the governor and approved by the Joint Finance Committee is somewhat open-ended. It would allow the State Department of Health Services to decide if there would be any exceptions to the 4-year rule. But if there were none, cancer is just one chronic disease the 4-year limit would impact. We've also heard today from advocates for patients with multiple sclerosis who are also concerned with the change. Greg?
All right, we'll keep following this as it moves through the legislature.